Hello and welcome to 360 Health on TV 360 Nigeria. Thank you for staying with us. I am Ogechukwu Okekwe. The World Health Organization has said half of the world total population does not have access to essential health care despite global efforts. According to the global body's Director General, Tedros Ghebreyesus, a significant number of people are excluded from health care and about 2 billion people face financial hardship due to out-of-pocket health spending. Tedros said this at the 77th World Health Assembly in Geneva, Switzerland. The assembly, which was world leaders in attendance, is themed All for Health, Health for All. At the event, Tedros said there is a regression in the rate of financial protection of citizens seeking health care at a global level. The Coordinating Minister of Health and Social Welfare, Ali Pate, has provided some hope for Nigeria's health professionals, promising adjustments in their wages very soon. The minister made this declaration on the first anniversary of President Bola Tinubu. Over the years, health professionals in Nigeria have several times complained of low wages as well as non-payment of their hazard allowance, among others. This has in many occasions led to industrial action, creating instability in the nation's health sector. As a result of the instability some of these issues have created in the nation's health sector, many of Nigerian health professionals have migrated to other countries, creating a brain drain sector. Speaking on the brain drain in the health sector, however, the minister said that President Bola Tinubu's administration had taken some decisive policies which are now addressing that problem. Medical experts and civil society organizations have called on the federal government to fully implement the graphic health warning on tobacco packaging and labeling. According to them, this is an effective way to spread awareness, but the risks associated with tobacco products reduce consumption and be helpful for those with limited literacy skills. Newsmen observe that in Nigeria, while there are some graphic warnings on cigarettes and other non-for tobacco products like shisha and snuffs among others, meanwhile, the World Health Organization mandated the parties to the Framework Convention on Tobacco Control to put in place policies in tobacco product packaging to provide health warning, describing the harmful effects on tobacco use. We'll go on a short break, but don't go away. Welcome back. Cervical cancer is a type of cancer that occurs in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. It is primarily caused by persistent infection with high-risk type of human papillomavirus (HPVs). While HPV infections are common and often resolve on their own, persistent can lead to development of precancerous lesion, which if left untreated may progress to invasive cervical cancer. Well, joining me on the program to discuss further is Senior Registrar Department of Obstetric and Gynecologist at Federal Medical Center, Bida, Niger State, Dr. Afar Yusuf. Thank you for joining me on the program, Doctor. So majority know that cervical cancer occurs in the cervix. Can you expand on knowledge on what cervical cancer and how it develops?
Thank you very much. So cervical cancer literally means cancer of the mouth of the womb, which we refer to as the cervix. It is one of the most common causes of cancer deaths. This cancer occurs within the ages of, say, 15 to 59 years. It is also the second most common cancer cause of death in Nigeria, Africa, and even worldwide. It is a malignant disease or tumor that affects the mouth of the womb, which we refer to as the cervix. Now, this is a worrisome disease to us. In fact, currently, it has been seen as a disease of public health importance because cervical cancer is a preventable and curable disease, which has really bordered much on women of reproductive age group, so to say. Given the burden of about 500,000, about 500 million new cases every year, with about 300,000 deaths every year. And it will interest us to know that 90% of this mortality or death occur in developing nation, of which Nigeria is one of. By 2030, if care is not taken, the incidence, meaning that occurrence of new cases of this cancer, will increase to the tune of, say, 700,000, while the death is estimated to be about 400,000 if we don't do anything about the disease. So, according to WHO also, they said at least one woman dies of cervical cancer every 2 minutes. Each of them is a tragedy and the reason why we need to prevent it. And if you put mathematics to it, that means in 20 minutes, about 10 women would have died of cervical cancer. Now, out of these 10 women, 3 out of them is occurring in Africa. That's about 21%, so to say. This should really open our minds to how very important this disease is and how common it is in our environment. And to also say to us, what are we doing as a country? What are we doing as a continent? And how do we entirely, as individuals, try to prevent or reduce the menace of cervical cancer?
So what would you say are the symptoms of these diseases?
Well, most times the symptoms of some of these ailments might not really be specific, but commonly what people with cervical cancer present with, because of the fact that it happens in, I've told us the age range at which cervical cancer occur. Most of them present with bleeding from their private part, from their vagina, which we call a vaginal bleeding. And most of this bleeding, many times, are either post-coital, after sexual intercourse with their spouses. Some of them will present to you with bleeding following that nature. Mind you, there are other things that could cause that kind of bleeding, but most importantly, when you are seeing a woman around, say, 40 years of age and all of that, you start thinking, what are the possible things that could lead to that, of which cervical cancer is one of? So sometimes, most of them present with postcoital bleeding. Some of them present with intermenstrual bleeding, and also some of the mostly patients present with symptoms of vaginal discharge. So majorly, these are symptoms that they present with: vaginal discharge, irregular bleeding, postcoital bleeding, intermenstrual bleeding for those that are still having their menses, or some of them will present with weight loss and other symptoms of progression of the disease. Some might be anemic, meaning their blood level will be low at the time they are presenting. Some might look cachectic, and other more, or even some form of presentation following the progression or metastasis of the disease to other adjacent organs.
What are the main types of stages? What are the main types or stages of cervical cancer?
Okay, well, when you're talking about, we have classification of cervical cancer. You know, we have the pre-malignant phase of cervical cancer. What we mean by pre-malignant phase of cervical cancer, it means that at that level, the progression has not reached a cancer stage. It's a process of getting into the cancer phase, and that's what we call pre-malignant or pre-invasive phase of the cancer. And in that, which we call a cervical intraepithelial neoplasia, we have a stage 1, we have a type 1, type 2, type 3, or stage 1, stage 2, stage 3, however you want to call it. At this phase, this is the earliest form that you can get the stage 1 of the cervical intraepithelial neoplasia that we call CIN, or 2 or 3 of it, after which you have the tumor already eating up into the basement lining of the cells, entering deep into the cell, where we call the cervical cancer in situ, and you now start having the stages 1, 2, 3, 4. Either the tumor is within the mouth of the womb that we call the cervix, or it has extended beyond that and affecting the adjacent areas like the vagina, going to the uterus, and also the parametrium, or the the parametrium, and also including the rectum, the bladder, the kidneys, and distant part of the body. So that's how to put it into a stage so that people will understand how this disease will progress. Then also, the disease could either be in a form of what we call squamous cell carcinoma, adenocarcinoma, the commonest one, which is the squamous cell carcinoma. All of this, what malignant transformation means is that a cell layer is changed from what normally it is into another form, which we call dysplastic changes. So when you have these dysplastic changes around the cervix, it progresses gradually. Normally, the cells of the reproductive tract have their tissue origin.
So what would you say are the standard treatment options for cervical cancer, and how do treatment options vary depending on stages of cervical cancer?
Yes, so thank you. The options of treatment depends on the stage of the disease. Now, remember that I mentioned earlier that there is a pre-malignant phase of this disease, which we all are very happy if it is detected as early as that stage, because the treatment is better. The options are ablative therapies. You can do excisional therapy, meaning that you just take a look at where the lesion is and you use instruments. For example, we have the thermal ablation, using something to just put a heat on it, or you use a cold knife conization, or you just cut that particular area, either using a lid or lip, and you take the sample away.
So can you expand our knowledge on the risk factors to cervical cancer?
Yes, the risk factors to cervical cancer include those that have multiple sexual partners. The reason why this is a risk is because human papilloma virus is has been to be a culprit in the pathogenesis of cervical cancer. So, and this virus itself is transmissible majorly via sexual intercourse. So, those that have multiple sexual partner are at increased risk of cervical cancer. Those that have early sexual debut, meaning that early coitus have their sex at a very tender age, at early age, are also at risk of cervical cancer. Then cervical cancer will also occur in those that have HIV infection, because obviously from the low immunity and the fact that there's what we call HIV attributable disease and HIV associated cancer. So, and I think about 5% of cervical cancer are associated with HIV. Then also there is a low immunity in those individuals, making it easy for the human papilloma virus itself to thrive in them, and also make it easy for the progression of the disease. So these are some of the risk factors of cervical cancer. Of course, the age group at which you get the cervical cancer, majorly I've already said it, that 15 to 59 years mostly. Getting to that, the other extreme is when you find the disease. So that is also a risk factor to the development of cervical cancer, among others.
So how does this HPV relate to cervical cancer, and how does HPV vaccines play in preventing cervical cancer?
Okay, so the human papilloma virus that we call HPV is just a virus. I want to believe we understand what a virus is, tiny organism within the system. And what it does, there are different strains, I think about 130 strains of this disease. Now, among them, we have the ones that are low risk to us in terms of causing cervical cancer. We have those that are high risk in terms of causing cervical cancer. So the low risk ones are the 6, 11, and all of that, while the high risk are the strains of 16 and 18. So what they do is that they enter into the body system. Now, this human papilloma virus can be carried by men and women. And when it stays in the body system, naturally the body system have a way of clearing the virus. However, the virus will stay up to about, say, 3 months, 2 years before it can even start causing the disease, and it becomes about 2 to 10 years, then it progresses to full-blown disease in about another 10 years. And that's why some will put the course of development or progression of the disease to, say, about 20 years, meaning for the virus. So what the virus does is getting into the body system, it changes the DNA setup of the body system around the mouth of the womb, and as such, change, you remember earlier I said that the reproductive tract system has cell linings that have their own structure, the way they are made. So what it does is that by changing the DNA, it now work on that and change the cell lining from what it used to be to another form entirely. And from there, it's now able to take over the growth of that area. And what tumors do, or malignant tumors do, they grow excessively, geometrically, and it's progresses like that gradually from the pre-malignant states into full-blown disease, and continue growing if nothing is done to it till it becomes a full-blown disease. So that's what basically the human papillomavirus does to that area, among other factors. Remember also, part of the risk factors of cervical cancer is a low income class or low socioeconomic status, obviously, because the nutrition will be low in them. They don't even have basic amenities to take care of themselves. They don't even have money to go for some screenings to test themselves and all of that. They don't even have money to present to hospital early. So because of that, you find it more in them.
What screening tests are available for cervical cancer, and how often should they be done?
Okay, so sorry, before we go into the screening test, I remember you said that, and how does the vaccine helps? Now,
Yes, in
since we,
preventing cervical cancer.
yes. So now that we talk about human papillomavirus to being the main culprit, around 2020, I think specifically on the 17th of November 2020, there was an adopted strategy that was developed called Global Strategy to Accelerate the Elimination of Cervical Cancer as a Public Health problem. So this global strategy was launched in 2020. This was despite a COVID-19 pandemic. That's to tell you how WHO and the whole world tried to see how to eliminate cervical cancer. And what is the motivation for this step is because this disease is caused by a known agent called a human papillomavirus, and there are also medical tools that are necessary to prevent it and cure it are said to be available. They at that point set a goal to eliminate cervical cancer from the world by the end of the century, and they want to maintain an incidence rate of very low as having 4 per 100,000 women coming down with cervical cancer. They came up with targets which they tagged 90, 70, 90. And what does the 90, 70, 90 means? This is supposed to be achieved by 2030. The 90, 70, 90 target, the three targets cover two broad areas: protecting the children by means of vaccination that we just mentioned, and also securing the health for adults. How do we do that? Screening for the pre-cancerous lesions that I mentioned earlier, and treatment of those that already developed the cervical cancer, meaning you have to treat those that have the pre-cancerous lesion. You screen for it, you treat those that have the pre-cancerous lesion, and also treat and manage effectively those that have the cancer. And what the 90, 70, 90 target entails is that by 2030, WHO wants to ensure that 90% of girls are fully vaccinated with human papillomavirus vaccine by the age of 15. The screening method, as we have mentioned, we have the low profile and the high profile testing or screening. We have the visual inspection with acetic acid. We have the paponuclear smear with the cytology. Then also we have a visual inspection with glucose iodine using colposcopy. Then we have the high profile or high performance test, which is the human papilloma virus DNA testing, which is said to be higher in terms of sensitivity and specificity detecting the cervical cancer. So majorly, women that are younger than 21 years, if they are not sexually active, there might not be need for screening in them. But women that from 21 to 29 years of age could do cytology screening alone. That's the papaniculus smear every three years. While women that are 30 to 65 years of age could do the human papilloma virus testing and the cytology code testing every 5 years. Or if they are going to do the papanicular smear, that's the cytology test alone, it should be every 3 years. Then women that are older than 65 years of age have no screening. No screening is necessary for them after they have done a previous test that are probably shown a negative results. So, but however, for those women with that are older than 65 years with a history of maybe the pre-malignant state, as I mentioned earlier, the CIN2, CIN3, or the adenocarcinoma form that I mentioned earlier, they should continue their testing routine age-based screening for at least the 20 years. So, and also for women that have had a total hysterectomy, that's removal of their womb now, no screening is necessary. So that's the screening method and how frequent it can be done as simple so that people will be able to get that.
What are the prognoses for someone diagnosed with cervical cancer?
Yes, it is unfortunate that the presentation of our patients with cervical cancer is almost always late, meaning that most of them present at the late stage of the disease, sometimes at stage 3, even as worse as stage 4 disease, where there is little or nothing that could be done. Remember, I said for stage 4 or advanced, very advanced stages, it's only majorly palliative care and one or two other immunotherapy or other thing that can be given to the patient. So if the patient is presenting very early, better still, even at the pre-malignant stage, the prognosis is fantastic, very good. However, if they are presenting at a very late stage, the prognosis is poor. And about 77% of those that are presenting with a late stage die within 5 years. So it's as worse as that. And that is why cervical cancer being a preventable and treatable disease, we advocate for health education, sensitization of the public on the disease, that it's a disease that can be prevented by health education. People should avoid the risk factors. People should take care of themselves, protect themselves. For those that avoid all these multiple sexual partners, or better still, use condom to prevent the transmission of this disease. Remember, I said it's transmitted via sexual intercourse. Tobacco use and all of that should be reduced as much as possible. So I haven't done that sensitization. Then there comes vaccination. Vaccination of even the girls. Even some countries have even moved to vaccinating even the boys themselves, so that at least it also cuts the chain of the transmission of the human papilloma virus that eventually could lead to disease. Then also the screening that I mentioned earlier will help us to detect the early stage of disease, or to diagnose the disease as early as possible and manage as they present to us. So if all of these are put together, the patient presents very early, you see that the prognosis is very good and would have been able to reduce the progress of the disease.
How does cervical cancer affect fertility and sexual health, and what are the options for preserving fertility?
Yes, the option for preserving fertility is, for depending, it doesn't mean that a woman with cervical cancer cannot have a child. Now, it depends on the phase at which you are detecting the disease. If it is pre-malignant phase, it's very easy. By the time you do the ablative therapy, you do the excision and all of that, after sometimes the woman can get pregnant because it's a multidisciplinary approach. After sometimes the woman gets pregnant and the woman can have the baby. But if already in the stage 1, stage 2, and the woman is desirous of fertility, if it is an early stage of the disease, sometimes if it is diagnosed early, maybe around 16 weeks, before 20 weeks, the woman can undergo some form of surgical treatment. But if it is later than that, they have to weigh the risk, because if you are going to give chemotherapy, the disadvantage, it has effect on the baby. All of that has to be put into consideration. And for those that are going to have their womb removed, are going to have a hysterectomy, or maybe hysterectomy with total bilateral sapingo oophorectomy, meaning removing the womb and also removing the eggs, as the case may be. For that, there's room for cryopreservation.
Well, Senior Registrar Department of Obstetric and Gynecology at Federal Medical Center, Bida, Niger State, Dr. Afo Yusuf, thank you for speaking with us on the program. And that's it on this episode of the program. Till I come your way next time. Bye for now.